Hello, and welcome to week 6 of PA113. This week we are in chapter 7 and 8 of your book, Understanding Pharmacology. So I wanted to talk a little bit about the chapter and then also talk to you about your discussion question and the drugs used there. So going into chapter 7, it's called Urinary Drugs, and we're going to start off with diuretics. Diuretics help kidneys, heart, that kind of thing, because they're also called water pills, easy for pharmacy technicians to remember. A lot of patients will actually refer to the medications as their water pills, so this is how you will refill them if they ask for them. And so here are the names of the diuretic drugs under there. There's also loop diuretics, and they just work on a different type of the body, the loop of Henle actually. And it gives you a picture of that on the next page, so you can see exactly where the diuretic drugs work. And I think it's really interesting for you to know, so that science is behind every time that you're filling this prescription, and you know a little bit about it. There is a drug alert on the next page. I like to point these out. The thiazide group of diuretic drugs can also cause drug interactions with different kinds of drugs. And so like anticoagulant drugs. Remember, if you break that word down, anticoagulant, that's actually a blood thinner. Anti meaning to not, and coagulant means to form a clot. Coag means to break, anti-coag means to break down a blood clot. So when you're going through these different names of drugs, or you're going through these different sciences of how these drugs work, just remember that these names can be broken down into different smaller words, and that's how you can figure out what they're talking about. So anticoagulant, just like I just did there. All right, talks a little bit more about potassium supplements as well. Patients are frequently prescribed potassium supplements with thiazide diuretic and loop diuretic drugs because there are a lot of potassium lost. The water pills, why they're called water pills, is because it takes any excess water out of your system, and your kidneys are getting rid of them very quickly. So if you're not a person with good kidneys, they probably would not put you on a water pill because your kidneys aren't working properly, so that wouldn't get rid of the medication properly as well. It goes into talking about drugs that treat urinary tract infections. Did you know cranberry juice is really effective in treating urinary tract infections? And so a over-the-counter medication that I wanted to tell you about is Azo, A-Z-O, cranberry. It's something that you can give your UTI patients if they're feeling some of that. Always ask a pharmacist first, but they usually will tell you to direct them that way, because a lot of cranberry juice has so much sugar in it that you don't want to just feed them that cranberry juice, but to give them an Azo cranberry, which is actually a cranberry in a tablet form. So that will help your urinary tract infection patients. So going in, it ends the chapter with treating erectile dysfunction, or ED, as it is abbreviated in a lot of prescriptions. It will be abbreviated just like that. Viagra, 5 milligrams, 1 QD, PRN, ED. So that's one tablet as needed for erectile dysfunction. PRN, usually as needed. And so it says, did you know a little bit about Viagra? It was the first to treat erectile dysfunction. It was approved in 1998. The first 3 months it was on the market, physicians wrote over 3 million prescriptions for it. So I like how it goes right into this. And then there are different ones now that you can see that are now prescribed. Levitra, Cialis, these are all different drugs, help with ED. And then, of course, you have your chapter review at the end that you'll want to do. Going into chapter 8, antiemetic drugs is what your discussion is about. So I really wanted to talk to you about that to end our lecture today. So going into chapter 8, I'm going to turn into your antiemetic drugs and what they're used for. Just a second, let me find it here. Page 127 is your antiemetic drugs. Page 127 is your antiemetic drugs. They're used to control nausea and vomiting associated with different types of diseases, such as chemotherapy, radiation. So patients will get this when they're having the nausea and vomiting. And also pregnant women may need antiemetic drugs also. And so it lists all those there. A popular one, Haldol, Thorazine, excuse me, Tigan. It's also used for motion sickness or vertigo. Vertigo is like the sensation of lightheadedness, dizziness, and whirling caused by irritation or infection in the inner ear. So if someone even has an ear infection, they can have some vertigo with that. And then they've got Dramamine also as an over-the-counter for to treat an antiemetic drug that way. And then that ends your chapter in the chapter review. So I hope this was helpful. Maybe you can help you to answer your discussion questions and then your chapter review. If you have any questions this week, please email me. I would love to hear from you, and talk to you soon.